Beyond cholesterol, the heart attack, hypertension, and stroke risk factors. Cholesterol, a name that echoes throughout the world of cardiovascular health. However, what if I told you it is only part of the story? There are crucial lab tests your doctor might be missing when assessing the risk factors for high blood pressure, heart disease, stroke, and other cardiovascular complications. If done in time, these overlooked lab tests could save your heart. The vital reality is that traditional cholesterol tests fail to offer a comprehensive picture of your cardiovascular well-being. Make sure you stick around until the end, as we will also explore the limitations of the traditional cholesterol test and how these additional tests can enhance the understanding of cardiovascular risk and management. In the bustling city of Hartville, there lived a man named Paul. He was an ordinary guy, just like you and me. He had a job, a family, and dreams of a long and fulfilling life. But one thing set Paul apart: he had always been diligent about his health. Paul went for his regular checkups, ate what he believed to be a heart-healthy diet, and thought he was doing everything right to protect his heart. Like many others, his doctor focused on the usual suspects: cholesterol levels, blood pressure, and other common markers. Paul's cholesterol numbers looked good, and his blood pressure was well managed with medication. But here's the twist in the tale: despite all his efforts and conventional medical care, Paul found himself in the chaos of a heart attack one fateful day. It was a stark wake-up call that shattered his belief in the status quo of heart health. As Paul lay in the hospital bed, he couldn't help but wonder what went wrong. How did he end up here when he had been so vigilant about his health? Paul's and the journey of countless others serve as a poignant reminder that, at times, even when we believe we're taking all the correct measures, crucial elements are often missing to understand the puzzle of heart health fully. The lab tests we will explore offer a more profound and comprehensive analysis of overall heart health compared to conventional markers. They determine your current condition, provide a reference point for comparison, and track progress as you embark on a tailored treatment plan for hypertension and heart disease. Know your LP, A, and ApoB numbers. Traditional cholesterol testing, though commonly used, has limitations. It focuses solely on cholesterol levels and overlooks essential details about the number, size, and types of particles carrying cholesterol, including LP, A, and ApoB. Interestingly, cholesterol levels alone are not bad or sufficient to gauge the risk of a heart attack and other cardiovascular events. Sometimes, a high cholesterol number might not be as dangerous as it seems, while a low number can carry significant risk. Surprisingly, insulin resistance is a more reliable predictor of heart attack risk than LDL cholesterol levels. Fats like cholesterol and triglycerides don't dissolve well in the blood, which is primarily composed of water. Instead, they are carried by specific transport proteins called lipoproteins. One of the most commonly known lipoproteins is LDL, conventionally known as bad cholesterol. Another lesser-known lipoprotein is lipoprotein A, or Lp(a). Although LDL remains in the limelight, Lp(a) can be incredibly sneaky. High levels of Lp(a) elevate the susceptibility to cardiovascular ailments like heart attacks and strokes. Another less commonly measured component is apolipoprotein B, ApoB, the structural protein of all atherogenic or plaque-forming lipoproteins, including VLDL, LDL, and Lp(a). LDL-C is commonly measured in routine cholesterol blood tests and specifically quantifies the cholesterol content within LDL particles. While ApoB is more like a head count of all the troublemaking atherogenic particles, including LDL, VLDL, and Lp(a). It's like knowing how many suspects are in a crime scene. In simple terms, ApoB is necessary for atherosclerosis to occur, so eradicating it could eradicate atherosclerosis. ApoB also provides a more precise measure of the effectiveness of cholesterol-lowering drug therapy. Biomarkers like LP(a) and ApoB are independent risk factors and highly precise predictors for evaluating heart disease risk. They can play a crucial role in the management of heart disease. ApoB surpasses LDL cholesterol in predicting plaque formation and cardiovascular risk. It's a superior indicator of atherogenic risk compared to traditional cholesterol measurements and is the primary contributor to coronary heart disease. Consistently monitoring LP(a) and ApoB levels is very helpful in assessing progress over time and guides the decision-making process regarding the need for more aggressive strategies. Normal LP(a) ranges are typically less than 30 mg per deciliter, and for ApoB, less than 90 mg per deciliter. These numbers don't lie. The higher they climb, the more urgent it becomes to dive headfirst into your doctor's recommended treatment plan. We are talking about no-nonsense commitment fueled by a tailored diet and exercise regimen. Watch our videos on Top 10 Foods to Unclog Arteries Naturally and Prevent Heart Attack, and How to Control Hypertension Without Medicine, Manage High Blood Pressure at Home, for further information. Sometimes, it can be daunting and unclear how to start eating healthy after a lifetime of mindless eating. That is where our 3-month challenge of healthy eating comes in to help revamp your health and improve your lab markers. Check it out in the description box and pinned comment. Regular cholesterol tests also cannot determine the LDL particles' size and number. We must consider these particle characteristics for a more comprehensive view of heart health. The test that provides all the aforementioned crucial information is called lipid fractionation panel. It allows for a better understanding of the different types of cholesterol-carrying particles in your blood, which can provide essential insights into your cardiovascular health. LDL particles come in 2 types, small and dense, which are more hazardous, and large and fluffy, which are less so. Smaller, denser LDL particles, often associated with higher LP(a) and ApoB levels, are linked to conditions like metabolic syndrome, insulin resistance, and high triglycerides. Lifestyle choices, especially diets high in carbohydrates and sugar, can influence LDL particle size. Meet your heart's personal investigator, the CAC score. CAC score, CAC score, or coronary artery calcium score, is a valuable tool for managing hypertension and heart disease. The CAC score quantifies the extent of calcified plaque in the arteries that supply the heart, called coronary arteries. A high CAC score can indicate an increased risk of heart disease, hypertension, future heart attack, and other cardiovascular events. Reducing the CAC score may help lower blood pressure and improve cardiovascular health beyond traditional risk factors. The higher your CAC score, the higher the odds of heart issues. Surprisingly, even folks focusing on prevention can face similar risks to those with known heart problems. A total CAC score equal to or less than 10 is associated with a lower incidence of coronary artery disease. There is a 5-fold difference in coronary artery disease, CAD, rates between those with CAC scores less than 10 and 10 to 100. A CAC score of 9.8 is an optimal cutoff point for discriminating obstructive coronary artery disease. Individuals with a CAC score of 100 or higher have a significantly increased mortality risk, regardless of age or other risk factors. Lowering your coronary artery calcium, CAC, score can reduce high blood pressure and the risk of future atherosclerosis-related cardiovascular events beyond traditional risk factors. If you're as passionate as we are about rewriting health rules, share these videos with your loved ones and hit the like button. Your support fuels our mission to create a healthier world, one heart at a time. And while it's a powerful tool, your CAC score isn't the whole story. Many doctors overlook a crucial lab marker when ordering blood work for high blood pressure and heart disease. Astonishingly, addressing this factor can resolve most cases of hypertension and heart disease due to atherosclerosis. Let's meet homocysteine. Homocysteine is considered the second most significant independent risk factor for hypertension and heart disease, with insulin resistance claiming the #1 spot. Elevated homocysteine levels, also known as hyperhomocysteinemia, significantly increase the risk of cardiovascular issues. These include atherosclerosis, blood clots, heart attacks, strokes, and high blood pressure, especially systolic pressure. Hyperhomocysteinemia takes a toll on the body by causing damage to endothelial cells within blood vessels, leading to the constriction of tiny arteries, impaired kidney function, increased sodium reabsorption, atherosclerosis, and hardened and stiff artery walls that are no longer flexible. These factors collectively contribute to an elevated risk of hypertension and other cardiovascular diseases. What's striking is that approximately 30 to 50% of the population possesses genetic variations predisposing them to high homocysteine levels and the associated cardiovascular risks. It's vital to take action when homocysteine levels exceed 10 micromoles per liter. Effective management involves a combination of dietary adjustments along with supplementation using methyl donors. Comment below if you want to know more about that. And be sure to click that subscribe button and give this video a thumbs up as a sacrifice to the mighty algorithm. And if you're feeling extra generous, share your thoughts in the comments below to keep the algorithm well-fed with engagement. Ask for a thyroid panel if not done already. The thyroid panel is pivotal in evaluating hypertension and heart disease because thyroid function significantly affects cardiovascular health. Here's why it's essential. Individuals with lower serum TSH, thyroid-stimulating hormone, levels are more likely to have carotid plaques and a higher risk of experiencing strokes. Thyroid hormones influence metabolism and energy production, and thyroid imbalances can lead to blood pressure fluctuations. Hypothyroidism is often associated with low blood pressure, while hyperthyroidism can cause hypertension or high blood pressure. Thyroid hormones impact heart rate regulation. Hyperthyroidism can result in a rapid heart rate, called tachycardia, which strains the heart and raises the risk of heart disease. Hypothyroidism, conversely, may lead to a slow heart rate or bradycardia, affecting heart function. These hormones even have a role in lipid metabolism. Thyroid issues can lead to abnormal lipid profiles, including elevated levels of oxidized cholesterol, a risk factor for heart disease. They also affect the endothelium, the lining of blood vessels. Thyroid dysfunction can contribute to endothelial dysfunction, a key factor in the development of atherosclerosis. Thyroid hormones influence cardiac output, impacting heart function and cardiovascular risk. They interact with other hormones, such as insulin and cortisol, affecting glucose metabolism and stress responses, which are relevant to heart health. Thyroid dysfunction can lead to irregular heart rhythms, called arrhythmias, which can be dangerous and contribute to heart disease. Thyroid function influences the body's response to certain hypertension and heart disease medications. Knowing thyroid status is crucial for effective treatment. Consequently, a thyroid panel is indispensable in assessing hypertension and heart disease, aiding in identifying and managing thyroid-related factors impacting these conditions. If you find this content beneficial, please consider donating to help sustain our channel and continue delivering value. The donation link is in the video description and pinned comment. We genuinely appreciate any contribution you can make. Link between ferritin and heart health. Ferritin, a key marker of iron levels, is gaining prominence in heart disease research. Elevated ferritin levels are closely connected to high insulin levels called hyperinsulinemia and chronic inflammation. It's important to note that when ferritin is high, it doesn't necessarily indicate iron overload. Here's what the studies have found. Number 1, serum ferritin levels are potent predictors of atherosclerosis progression. Men with ferritin concentrations above 200 microgram per liter face a 2.2-fold higher risk of heart attacks than those with lower levels. Number 2, elevated ferritin levels are linked with an increased risk of hypertension. Number 3. The iron-heart connection extends to other cardiometabolic diseases, including cerebrovascular and coronary heart disease, CHD. Number 4. Higher ferritin levels are associated with an increased risk of heart failure. It is a crucial insight into heart health. These findings offer a glimpse into the evolving understanding of how ferritin levels might impact heart health. Please share your health goals and challenges in the comments section. Your questions and comments are highly valued. Stay tuned for the upcoming videos for actionable steps and expert insights with a community of like-minded individuals on a mission to achieve optimum health and wellness. I will drop a step-by-step guide on optimizing each lab marker in the description box and pinned comment, all with dietary and lifestyle modifications. So keep an eye out for that. If you have stayed around thus far, this shows you grit and determination. All that is needed is to take the first step, and 85% of your health is just what your taste buds signed up for. Check out the recipes link in the description box. These recipes are carefully crafted with heart-healthy, low-carb, low-sugar ingredients packed with essential nutrients, making them an excellent fit for weight loss and diabetes management, clogged arteries, and hypertension. And if you want to know how to reduce arterial plaque progression by an impressive 95%, watch the video showing up on your screen next.